Hey everybody, welcome back to another edition of What's for Dinner. I hope you're all doing well. Remember, nothing you hear or see tonight should be considered medical advice. If you guys have questions, reach out to your highly professional and well-trained healthcare provider for those questions. And where can those people be found, Teresa?
For hormones, worldlinkmedical.com. And for metabolic health, lowcarbusa.org or smhp.org.
Yep, all those sites have provider directories on them. So go in there, use the provider directory. So this is Teresa, and I'm Mark. We're your hosts for What's for Dinner, and I'm a health coach, and Teresa is a board-certified family nurse practitioner, licensed in multiple states, and she specializes in bioidentical hormone replacement therapy, or BHRT, and metabolic health. So that's insulin and sugar stuff, and weight loss, fat loss, all that kind of good stuff. So we're not really going to go over too much tonight with what we're eating. We're just doing eggs. We're doing basically leftovers, guys, and then we also I cooked up some brats. Suffice it to say that this is a low insulin way of eating. That's what we do. So we minimize our carb/sugar intake, which in turn causes our insulin to move minimally. And as everybody should know by now, insulin is the fat storage hormone. So we're trying to, instead of storing fat by increasing our insulin, we're trying to get the fat out of storage and use that for fuel.
Yes.
So that's what our goals are.
There was a question last night, I think, when I said my sister's here and I fed her steak and burgers every day and not worried about her cholesterol. It prompted some cholesterol questions. And then we always do get them, always, sprinkled in here or there. We have family that whenever they come to visit us and we feed them like we eat, they say, oh, this is cheating. My doctor would have a fit. This is going to raise my cholesterol. So anyway.
Yeah. So one of them, Paula from YouTube, she's a YouTube subscriber. First of all, I wanted to say thank you for the question, because that question you sent, Paula, actually prompted what we're going to be talking about tonight. And also congratulations on you and your husband switching over to a carnivore/low carb/keto way of eating.
Yes.
And even calling it a way of eating, not saying a diet. So, I mean, you're getting it all right up front here. The verbiage, and you guys sound like you're on the right track, but it sounds like maybe your husband has some apprehensions about genetics and cholesterol and stuff like that. So we wanted to address that tonight because this is very applicable to a lot of people.
Yep. So the only way to know if you have FH, familial hypercholesterolemia, is to get a genetic test. But what providers will say is they want you just to shut up, because last night we told you they have about 3 to 5 minutes with you in your visit. They don't have time for questions. They don't have time for your internet search, which by the time I finish with you here, you're going to know more than your provider does. So they just want you to hush about it, and they say it's genetic without running a genetic test. The other thing is there's lean mass hyperresponders, and those are people like Mark. When he loses weight, lean mass hyperresponder, he hyperresponds to LDL. His LDL will go up over like 300, and his cholesterol will be up over 400. That there's nothing to do about. All you have to do, and Nick Norwitz, a PhD at Harvard, who's in the middle of his med school rotations, did a study. He took statins for 12 weeks, and then he ate Oreo cookies for 12 weeks. The Oreo cookies dropped his LDL better than the statin. So there's nothing wrong with being a lean mass hyperresponder except the numbers. If you don't want, the best way to avoid this is to not get your cholesterol checked, okay? Because now, let me tell you what cholesterol does. Cholesterol helps the immune system, repairs cells, decreases inflammation, synthesizes hormones, so that's sex hormones, testosterone in men and women. Vitamin D, it synthesizes vitamin D, delivers energy, supports muscle function, supports neurotransmitters, dopamine, serotonin, supports neurotransmitter and signaling and prevents vascular calcification. Wow. So we should block it. Also, I know who made me. He's a divine heavenly father. Your liver produces 70 to 80% of your cholesterol. So why would we block it? It's a natural functioning process in your body, but now suddenly we want to block it. Do you have something to add?
No, I'm just listening.
So they have done studies where they have taken out plaques in people's arteries from a heart attack and stroke. The analysis of the plaque in the arteries was 87%, plus or minus about 8%, was fibrous tissue. That's clots. That's your clotting cascade. Every time you eat sugar, you spike your insulin. Every time you inject insulin as a diabetic, that's why type 2s, we don't want you injecting insulin. And type 1s, we want you injecting the very smallest amount. Every time your insulin goes up exogenously from a shot or endogenously from your banana, it spikes your sugar, and then it nicks your coronaries. And then your liver has to go repair it with cholesterol forming over it. 7% are calcification deposits. 5% is just debris, and 1% is foam cells. So there's very little cholesterol that was found in there, but we want to say it was cholesterol, directly correlates with heart attack and stroke. All you have to do to bring down your LDL, if your provider gets excited.
So sorry, everybody. Trying to manipulate the phones here. We had it on Do Not Disturb. I promise it went through.
Yeah, that's weird. If you have a cholesterol test coming up, for the weekend before that, eat about 100 grams of carbs. It doesn't have to be processed carbs. It could be bananas and sweet potatoes. But if you increase your carbohydrate intake, your LDL will go down, your cholesterol will go down, and your doctor won't have a heart attack. Okay? So eating less frequently. So people like us, eating 1 or 2 meals a day drops your LDL. Eating less frequently will increase your LDL. Eating low carbohydrates will increase your LDL. If you have an increased BMI, it will decrease your LDL. These are all backwards. Like, we shouldn't be measuring LDL because they're counterintuitive with everything. You get what I'm saying? Are there any questions?
Not so far. Keep going.
So you want to make sure you are not a diabetic, you do not have insulin resistance, and you do not have metabolic syndrome. Those are the things that lead to heart attack and stroke. I have told you guys plenty of times, when I hear of a diabetic having a heart attack or stroke, I am sad, but I am not surprised, because that is the natural progression when you have these disorders. There is the Framingham Heart Study. Lower LDL is the best predictor of death. So as you age, these new lipidologists want your LDL. It used to be 70, used to be 100, then it was 70, now it's 50. They want your LDL that low. That increases your risk for all-cause mortality. Statins are mycotoxins. They are mitochondrial, they cause mitochondrial dysfunction. Mitochondrial dysregulation is prevalent in Alzheimer's, ALS, Huntington's chorea, Parkinson's. That's why statins and Repatha, this is the same. They'll say, oh, you don't have to take a statin, you can take an injectable. It's all the same. When you lower LDL and cholesterol, this is what happens to you. What was I just saying? Oh, so as you age, they want your LDL lower and lower, then your immune system gets lower, and then you're at an increased risk for all-cause mortality. For cholesterol that God made your body with, and your liver makes 70 to 80% of it, it's like saying hormones cause breast cancer, but we were made to make hormones. I just want to make sure I don't miss anything, because there's a lot to talk about on this one.
Yep.
Low LDL is associated with cancer. Wow. That's what everyone's worried about. No one cares if they get a diabetes diagnosis or a blood pressure diagnosis. Everyone cares when they get a cancer diagnosis. It's scary.
And low cholesterol does that.
And low cholesterol does that.
Low LDL anyway.
So, there's been lots of things lately, and people have come out and, written books and pulled studies. Mark and I talked about this before. This started when Dwight D. Eisenhower had a heart attack in office. The American public got excited. It was back when we used to make you do bed rest, like for 7 or 10 days, 2 weeks. So he was really out of commission for a long time. And the American people wanted to know why that happened to the president of the United States. And so people started, there was Yudkin that said it was sugar. There was Ansel Keys that said it was cholesterol. Everyone stuck on to Ansel Keys, even though there were no studies showing that or proving it. He did the 7-country study, which showed when you have an increased incidence of cholesterol, your heart risk goes up. What you don't know is there were 28 studies or 22 studies in that study, but he picked the 7 that made his line go like this to show what he wanted. And then the American politics got involved. So the Senate had hearings, and they decided to come up with the USDA guidelines for no reason, for no studies. There was no literature backing this up. It was just blindly saying it. And then we know food and pharma and all that stuff. I think statins, cholesterol lowering medications, whether it's the injectable or what, I think they're a gateway drug into the system, because as soon as you go on those, you're going to need shoulder repairs, knee repairs. It messes with the joints. You get ALS type symptoms. You get Parkinson type symptoms. You get 67% of people will get type 2 diabetes from statin use. Every diabetic, as soon as they're diagnosed with diabetes, gets a statin, even if their cholesterol is not high. Even if you go into the hospital with a heart attack, a stroke from a hole in your heart from being a kid and then when no one ever found it, eventually sometimes those things happen. Or a valve, you need a valve repair. They give you a statin because you had heart surgery. Like, it doesn't make sense. So next time your doctor wants you on a statin, what it also does is it destroys the mevalonate pathway. And so that you are unable to synthesize vitamin K, and then you cause calcifications. So if you, for instance, want to go to get a coronary calcium artery scan, if you're on a statin, be aware that statins cause calcification. So if you see calcification, it could be a direct result from your statin use over time. If you want to reverse the plaques in your arteries, if you see it on a CAC score, there's something called the Pauling protocol. It's Pauling, and you can look it up. It's high dose vitamin C, CoQ10, and some other things. Man, this bugs me bad.
So what if somebody is on? How do they approach their provider, or what do they do with regards to coming off? Is there a weaning protocol?
There is no weaning protocol needed. It's not like, testosterone or something where we want you to wean back off. You can just stop cold turkey. I know what I wanted to say too. The main side effect to statins that we all know about, and by the way, the inserts for Repatha and all the statins say in the insert, this has never been shown to prevent heart attack or stroke. Okay, so it says that in the insert. The number one thing is muscle pain. When I worked in neurology back when I was little, we used to round all the time on the hospital in the early 2000s, late 1990s, and people would have rhabdomyolysis because they had severe muscle wasting and poisoning from the statins. And all we would say is to stop your statin. It was easy. It was an easy consult. But yeah.
Okay.
I don't know. I was saying something.
No, I think you were, I was getting ready to ask you about relative versus absolute risk, because we were kind of going down that route a minute ago, and then you got sidetracked. So what's the difference? Because the studies showing that cholesterol had any bit of benefit at all were the ones that showed what versus what.
Yeah, so when people use relative risk reduction versus absolute risk reduction, if you use one, it looks like it's a 50% improvement. But if you use the right one, it's a 2% improvement. No. So just because you went 1 to 2 doesn't mean you had a 50% better outcome. There's statin calculators you can go on, and it's essentially for 100 patients to take. If you want to be helped, if I want to be helped on a statin, 100 people have to take a statin for 10 years for me to gain 4.4 days of life expectancy.
Wow, additional life.
Meanwhile, we're all going to have problems. Oh, I know what it's going to say, the muscle. The muscle pain is the number one thing. It can also cause asthma too, but the number one thing is muscle pain. What the pharma companies did was they took away muscle pain and they made it in 5 individual categories. So now instead of being like 90% of people will get muscle pain, it's like 4%, 20%, 2%.
So they broke them into different types of muscle pains.
Subgroups.
So it wasn't like 90% of the people, right, or didn't look like 90% of the people who were taking their statin were actually having muscle pain. They were looking like, a bunch of people had different types of muscle pain.
Right.
Yeah. Okay.
I mean, I think if you're, the doctors do push it, and you have to understand there's metrics they have to meet. If they don't meet metrics, they don't get paid correctly. If you're the one not wanting vaccines in the pediatrician's office or the one that's denying statins in their office, you are a drag on their bottom line. So you can get fired. So just be aware. But I would be wondering if many physicians or nurse practitioners know how the melavonic pathway works, that statins are a mycotoxin, that it destroys the mitochondria. I would love to know if they know the debate between Ansel Keys and the study that cholesterol-lowering medicines came on versus Yudkin. The answer is no.
Yeah.
But they want to tell you you're stupid for listening to online doctors or internet doctors. And they're talking about PhDs and people that do have clinical practice that are doing like we do every night before we sit down and eat. We figure out what we're going to say to you guys. We're trying to help, or this is our platform. This is our mission field.
Well, if they were doing their job, we wouldn't have to do this, is number one. And number two is that, by doing these things online is we can reach a lot more people. We've got a great successful practice here in Missouri, and we spread out to a couple of other states online as well. But we, how many can we reach? A few thousand doing, our clinical practice, right. But we can potentially reach, tens of thousands or millions of people online this way. So, I get it. Anyway.
And then I just want to give you a few people to look up regarding statins on YouTube. Then also, And a case has just been settled against Malcolm Kendrick, who wrote this book right here, Statin Nation. Malcolm Kendrick and Zoe Harcombe, who is a PhD. Back in 2019, the U.S. Daily Mail, which they're in Europe, they printed a story about these two physicians or doctors, calling them statin deniers and saying that the misinformation that they were giving out were making people cease their medications and be put at dangerously high levels at risk of heart attack and stroke.
By not taking their statins.
By not taking a statin.
Yep.
So it just came out that they were absolved. Then these two people sued them for libel. And they had to send an apology because everything they said was true. And
so the doctors sued the Daily Mail, the
Mm-hmm.
UK Daily Mail, and
Yep.
won, and won the lawsuit. And they found the Daily Mail was guilty of libel.
Mm-hmm.
Yeah.
Yep.
Okay.
Yep. So, okay. Number one, I love Paul Mason, and we just had the chance to finally meet him and see him in person in San Diego. Paul Mason, and specifically on YouTube, there's a great episode called "The Shady Truth About Statins." Okay, so Paul Mason, Ken Berry, of course, on YouTube, but Ken Berry did do a 1 hour talk with David Diamond, who's a PhD. Anything with David Diamond, also, he breaks down, he's from my alma mater as well, USF. He breaks down cholesterol. So anything with those two. Aseem Malhotra, who is a cardiologist in the UK and took a lot of flack about statins. But I have shared on my Facebook page some interviews with him, like in Joe Rogan, just talking about statins. Nadir Ali, of course, so sweet in Texas. He is an interventional cardiologist. Dr. Boz, who just moved to Tampa. So she does a lot of cartoon on YouTube about cholesterol, and it's just easy to look at. And then on Facebook, if you're on Facebook, there's two groups: No More Statins and Statins, the Silent Killer. Evidence-based, files in there, down to the nitty-gritty. They do know more than your providers do.
Yep.
Sorry.
Nope, it's all good. What else?
I don't know. That's all.
Did you miss anything?
It gets me so aggravated.
Well, I guess this is a good opportunity for me to plug in here really quick. It's just, guys, if you are just watching this and you appreciate what we're doing, if you haven't already, please like or subscribe, depending upon if you're on YouTube or Facebook. And if you guys can send us little heart emojis, stars, whatever your flavor is, our way. Also, any comments, all that helps boost our page and boost the algorithm. So that's all I'll say about that. So back to you, hon.
Yeah, that's all. We love you guys. We want you to be the best you can be, because what I always say is people are just surviving and they're not thriving. And the last 2 nights we've been talking about marriages and I mean, real life is hard. And so when you're trying to do it up against, outside influences, the enemy constantly after you, these physicians talking, if you go on these Facebook groups, every new person's like, my doctor said I have to go on a statin or I'm going to die. He said, I'm going to die. Your doctor doesn't know if you're going to die. I could die tonight. Nobody knows.
Yeah.
It's just such fear tactics. And it's just hard to go against the grain when you don't know.
Sure is. But all right, guys. Well, we're going to go ahead and wrap it up there. And I hope you guys enjoyed this episode. Please fire any questions you have our way. And as always, we love you guys
so much.
And God bless you all. We hope to see you at church tomorrow, and see you next time. Bye.
Bye.